So we have developed really remarkable treatments in multiple myeloma over the last few years, and the pipeline is large. As we see the next generation of CAR T-cell therapy and bispecifics and cell mods and so many other things, I think it's critical that we look at ways that they truly are accessible to all, which means we look back and say, what has prevented patients from having the best care possible? Whether it's early on, even in obtaining the diagnosis due to a delayed diagnosis, or indeed their access to those treatments. And people's access to treatment should not be based on their socioeconomic status, their race or ethnicity, their zip code, or even just geographically how close they are to a myeloma center. So looking at ways, both from a policy standpoint and a pragmatic standpoint, how we deliver this care. I think it's remarkable how we're seeing that many of these newer therapies that were initially thought to only be able to be delivered in large academic centers can now be delivered in the community. Even clinical trials, as we move to decentralizing clinical trials, I think we can make more and more of these treatments with this assistance of telehealth and community networks and a great partnership between the community oncologist and the myeloma expert. I really feel that the vast majority of patients can have access to the vast majority of treatments. Lastly, we have to look beyond our borders as well and look to see that the vast majority of the world has challenges accessing cancer care, whether it's in Africa or Latin America or Eastern Europe and Asia. There are so many places where there is limited access. We want to work together as a community to recognize those barriers and develop treatments that have greater access across the planet.